of all, I wish to thank God for this opportunity. May each one of us, wherever we are, we thank God for the gift of life. We also thank God for the gift of good health, as Godwin has said. It's a new year. We thank God for that, and we really need to plan for it. And of course, we put God first in everything that we'll engage in. So we wish to start a new year, and today we'll discuss a condition that I will mention. It's a condition actually I'm doing the third time. And you remember we said some of the conditions that we'll be doing, we wish for you to participate in terms of you requesting, and this condition has been requested during this festive season, about 3 or 4 people. So I think it's a condition that we need to revisit again, and this time I'll go through it very slowly. Now, every time we discuss a condition, we normally talk about it in detail or share something about it so that we're able to know where we stand. Now, as Godwin has said, we are going to discuss what we call amoebiasis. For all of us, we know it as amoeba or amoeba. It is a very common condition affecting all of us. It's a condition that is most common in what we call third world countries. And it's a condition that we really need to be keen how we handle it, because one of the causes or the problems that it's bringing about is the issue of us treating ourselves, what we call self-treatment, or buying drugs, and yet we really don't know what we are handling. Is a condition, as Godwin has said, that deals with what we call sanitation. Sanitation in that the water that we take or we drink, the greens or the fruits or anything that we eat, that we drink or eat when it's a bit raw, if we don't clean them, if we don't follow the rules of hygiene, then it's a problem that will really affect us. Is a problem that you hear many people, and I believe medics will support this, in that you find in most places, some of us have not been able to enjoy life, because when you go to a function, you are not able to eat the food you want. People are having so much diarrhea. People are having what we are calling stomach upsets. Many problems that relate into this, because sometimes we either don't treat treatment, we don't go for testing, and if we take treatment, we really don't follow the right protocols or the right ways so that we get the right treatment after testing. It is a condition that affects all of us in general, children and adults. Is a condition that is treatable. I repeat, is a condition that is treatable. So it means kuna madawa ambayo inaweza tibu ugonjwa. Na is a condition that of course we'll talk about a few terms and terminologies that will not be many, but basically we'll make it as simple so that we all understand. Now, when we talk about this condition, mostly you find it's a condition that is very common in places that are having people living a lot, in what we're calling urban centers or in towns. It's also a condition that is very common where we have what we call water issues or shortage. So wakati hakuna maji ya kutosha, inamaanisha usafi si mzuri, and this is a condition that you find will be very common there. So as we begin, as always, I wish to start with what we call a definition. And amoebiasis simply means an infection that affects humans through contaminated food or water, through orally, ama through kwa mdomo, and it's a condition that affects our stomach and mostly what we call the lower intestines. Pande ya intestines, pande ya chini. I repeat, by definition, amoebiasis, or what we call amoeba, is a condition that affects a human through what we call contamination of either water or food that we consume through the mouth, and it affects what we call our stomachs and the part that we call the lower intestines. It is caused by what we call a protozoa. Remember, when we talk about conditions or diseases, normally we talk of what we call a causative organism, ama ile kitu ambayo inasababisha. Kama malaria tunasema pia ni protozoa ambayo inaleta ugonjwa wa malaria. So in this case we also have a type of what we call a protozoa that causes this infection. Now, what do you need to know about this condition? Now, one word I wish to mention as we continue, and I know all of us have heard this. Umesikia watu wakitembea wakizunguka wakisema kuna dawa ya minyoo, dawa ya kuosha tumbo. So when we are talking about amoebiasis or amoeba, we are talking about kuosha tumbo. Kuosha tumbo inamaanisha we are talking of infections that we cannot see through our eyes, but they are there, and these are infections that are coming through contamination. Now, once I want to mention a few ways that you can get this infection, and as I've said, one of the most common ways that I can get amoeba or amoebiasis is through what we call water contamination. And this water means that sometimes maybe I'm living in an urban area, maybe I'm living in an area whereby there is contamination of sewage, ama choo. So if this water comes into sewage contact, it means already this water that we are supposed to drink is not hygienic. Now, if this water is not boiled, this is one of the ways that you get, or what we call sterilized, ama kuchemshwa, ama kuoshwa na machine. So we also get this infection through what we call greens, ama vyakula ambavyo havioshwi kabisa, ama vinaoshwa kidogo. And here we will talk of what we are calling now sukuma wiki, greens, managu, terere, all those. If they are either grown in areas that have contamination of sewage, or if you buy them and they are not cleaned before they are cut, and they are not cleaned with clean water, then it means you will have or you get this infection. Now, the other thing is what we call fruits. Fruits in matunda. And the other thing that is very common, we are talking now here, we said this condition affects all of us, but we wish to talk about what you are talking, what you are saying, what we mean, children. When we talk, even this involves us. When we talk about contamination, I wish to say something about choo, usafi wa mikono. You find our children, this will relate more to our children. Anytime children wametoka kucheza nje, wametoka shule, our mothers kindly make rules that make sure that they clean their hands properly with water and soap, so that before handling a food, before touching anything that will go through their mouth, it means they are clean and they are handled well. The other thing that you find this condition, and I know now this one relates to what we call the health sector of the Ministry of Health, and here we are talking about people who handle food. And here we've heard of people who are working in hotels, and I know you've heard that watu ambao wanaserve chakula wanapika ni lazima wapimwe, wahakikishwe hana magonjwa. Now, one of the conditions that is tested when someone has to go and work in a hotel is what we call amoeba. Because if amoeba can spread, as I continue informing you, through many ways, and through the hands, or when you cook food and you are infected, it means you can pass this infection. So the Ministry of Health, through the public health, has rules that say that if you have to handle food on a big scale, then you need to go for testing, so that we make sure that you do not infect others. Now, the other thing that will cause this is that is what we call fertilizers. I know most of us do what we call kitchen gardens or big scale farming, and sometimes the kind of waste that is used, if we don't give it its time, we treat it well, it means this can be a cause, because the stool or the waste that is used to make manure, if it's not digested or processed the right way, it means this can lead into this protozoa contaminating the water or contaminating the farmers or anyone who is handling the sewage or the soil. Now, the other thing is very common, and this actually covers all of this. There is what we call oral recto or recto-oral. Recto means the part where we pass through, and oral means the mouth. So you find when we are talking about our hands being clean, when we are talking about contamination from stool, you find that if my hands are not clean and I put anything in my mouth, then it means I will be able to get this infection. So simply we say that is this an infection that is treatable, but one of the main problems that we have is that when we talk about these conditions, wengi wetu tunanunua madawa, wengi wetu atuendi hospitali, tunaongea na daktari na tunaelezwa ni test gani ambao tunafaa tufanye ili tujue hasa ni nini tunafanya baadaye. So the next thing I wish to discuss before we go for a break, in all topics we always talk of like the signs and symptoms. Now the signs are those things that I'll see. Symptoms are those things that other people will not see but I'll feel. Like if I'm feeling cold, the other people around me may not know that I'm feeling cold. So the other thing that we need to know about this condition before we go now into signs and symptoms is that depending with the level of infection that I'll get through the water contamination or the sources that I've said, it can take me a short time to start getting the signs and symptoms, or it can take me a long time. So this is individual, meaning kunao anakaa sana, and awa anakaa sana as I continue to explain more about them. And kunao ambao wanapata infection na wanaanza kupata shida. Now when we talk about amoebiasis in signs and symptoms, we said this infection affects the lower part of the intestines, ama tumbo zetu, and of course all the signs will start from there. And one of the things that you find is that most people complain of what we call abdominal discomfort, kuumwa ni tumbo, kusikia tumbo vibaya, kusikia tumbo imejaa. There is what we call uchungu inaitwa colic pain. I know most of you have had this. Wakati unasikia uchungu ya kushika ikiachilia, ama cramps. So you are okay, and then you find that you are having what people even use the term stitch. Ile tumbo inashika ikiacha. Now the other things that you will have is that someone will complain of diarrhea, kuharisha. Na wakati mtu anaanza hii kuharisha, anakuambia daktari, choo yangu inanuka vibaya sana. Nikiangalia daktari, choo yangu ama ya mtoto, naona kuna makamasi. For those who come from the Mount Kenya region, you've used the word rorenda. Kuna makamasi ama choo inajivuruta. Later, if the condition has been there for long, most people will complain of what we call blood. Kuna hiyo makamasi na unaona red blood kwa choo. For children, this is very common for children. You find amoeba causes fever. So sometimes for mothers, tusifikirie fever ni homa ama malaria, saa ingine lazima uongee na daktari. And of course, atuelezea vile utafanya. Being a stomach, someone will complain of loss of appetite. Kusikia, kuhisi njaa haraka, ama kila wakati mnaenda pahali. Remember I mentioned like sometimes you never enjoy being in a function. Umekuta kuna nyama choma, mumeandaliwa chakula mzuri, na unauma kidogo, unasikia tumbo yako imefura, unauna appetite, ama unakula sana. Of late things are changing, you feel like every time, hata even 1 hour you want to eat again. There is what we call nausea. Nausea ni ile unahisi kusikia kutapika. Wakati unaenda haja kubwa, ama wakati unapita choo, unapata choo, unasema nasikia daktari, nasikia haja ya kuenda, lakini wakati naenda nasikia haitoki. So you find people complaining, nowadays when I go to pass stool, I don't feel relieved. Nasikia bado kama kuna shida. So people will also complain of what we call dizziness, kusikia kizunguzungu. And this will occur a lot if the infection has been here for a while. Now, this is not very common in Kenya, but in some parts, you find it out of the country. You've heard of things that are called amoeba abscess. Unaona mtu ama mtoto, ama vitu zinavimba kwa mwili, na wakati anaenda hospitali, test zimefanywa, daktari anakata hiyo kitu na inatoa uzaa mingi sana. Now, these are very common with amoeba that has been there for long. So you find someone has what we call amoeba abscess, and these are swellings around the stomach, around the body, that once they are cut or they are opened, you find that there is pus coming out. The other thing is that you find their skin changes. Na hii sana sana anajua akina mama wanaelewa, ama sisi wote. Mtu anasema mtoto wangu amegeuza ngozi, anakaa na patches za white. Msichana ama mtu yanga anakuambia daktari, nilikuwa mrembo lakini sasa hivi naona ngozi yangu ina madoadoa. Now someone will also have what we call lethargic. Unasikia uchovu au usikii kufanya kitu. The other thing that is very common, unasikia wakati tunasema tumbo imejaa. Someone anatoa gas ya choo, unatoa gas mingi na unasikia tumbo imefura. Wakati unaenda unapata kitu inaitwa tenesmus. Tenesmus, we said we'll be defining terms. Tenesmus inamaanisha wakati unaenda haja kubwa unasikia uchungu, either ukienda choo ama wakati umemaliza kwenda choo. Backache will also be there. So the other thing that is common in extreme cases, in other countries, like I remember some years in Britain, we had an amoeba that affected the brain. We had what we call an amoeba that eats the brain. This is not common in Kenya and Africa, but when we talk about amoeba in the African setup, you find that in most cases you find someone complaining, daktari naota ndoto mbaya za mashetani na shtuko wakati nimelala. This means infection has been there for long, and it means that it's even clamping up and going to affect the brain. So I wish us to stop there so that we can continue to the next step.
Natamani niwaeleze wote kwa pamoja, lakini haiwezekani. Nasema nanyi kwa wimbo, tunautafakari uhai tuliopewa na Mungu. Tumepewa bure, tutunze vema kitunu bora. Nayatangaza haya, watu wote msikie, uhai tulopewa tuutumie kwa wema. Tukumbuke tena uhai sio gari kwamba likiharibika utanunua lingine. Nakuomba Mungu wangu, nakusihi Bwana wangu, unipe nguvu na uwezo niyashinde magumu yote siku yangu itapofika. Nikuone Mungu ulionipa uhai toka tumboni mwa mama yangu. Nakuomba Mungu wangu, nakusihi Bwana wangu, unipe nguvu na uwezo niyashinde magumu yote siku yangu itapofika. Nikuone Mungu ulionipa uhai toka tumboni mwa mama yangu. Familia zayumba, taifa laangamia, kiburi cha uzima.